A very good morning, dear doctors. Welcome to AiMedTech, and today we are again going to discuss the different MCQ based session from different PG entrance examination. And our topic today is medicine. Let's start our session. On thyroid, this is the question one. On thyroid function test analysis, TSH value was much higher than the normal with a low free T4. What is the diagnosis? Options are subclinical hypothyroidism, hyperthyroidism, secondary hypothyroidism, and primary hypothyroidism. Go through the option and answer the question. Here is the correct option is primary hypothyroidism. See the lab finding. TSH higher than normal, free T4 low. So let's interpret the thyroid function test in case of different type of thyroid disorder. Actually, the relationship between the TSH and the free T4 is inverse and logarithmic. Means small changes in free T4 result in large changes in TSH. As you all know, T3, T4 secretes from the thyroid gland and TSH from the pituitary gland. Now let's see the diagnostic pattern. In primary hypothyroidism, what is the lab finding? High TSH with low free T4. Find it. Actually, the thyroid gland failure leads to the loss of negative feedback, and this will causes the secretion of more TSH. Now come to the subclinical hypothyroidism. What is the lab finding? High TSH with normal free T4. This is a mild gland failure and compensated mechanism causing the maintenance of the free T4. Now come to the secondary or central hypothyroidism. This is a condition. You see the typical low and normal TSH value as well as the low free T4. And next comes the hyperthyroidism. The lab finding, typical lab finding, that is the low TSH and the high free T4. So memorize the exact lab finding after proper conception related to the thyroid functions. Okay, the conception is necessary to understand those typical lab finding in different thyroid disorder. So here is the highlight fact. TSH actually the most sensitive screening test for thyroid dysfunction. In primary hypothyroidism, TSH rises before the T4 falls below the normal range. Try to memorize it. Now, here is the bullet point. High TSH, that leads to the low T4 value, the primary hypothyroidism pattern. Okay. So come to the next question. Which of the following is responsible for elevated level of triglyceride and VLDL in diabetes mellitus? Here are the options. Option A, increased activity of the lipoprotein lipase and decreased activity of the hormone sensitive lipase. Option B, increased activity of the hormone sensitive lipase and decreased activity of the lipoprotein lipase. Option C, increase in peripheral mechanism of function of LDL receptor, and option D, increased in activity of hepatic lipase. So go through the options and answer the question. The right answer is increased activity, option B, increased activity of hormone sensitive lipase and decreased activity of lipoprotein lipase activity. Now let's dive into the explanation. So as we all know, in uncontrolled diabetes mellitus, especially in type 1 and severe type 2, insulin deficiency or insulin resistance leads to the characteristic lipid abnormality. So, regarding the pathophysiology of dyslipidemia related to the diabetes mellitus, they are due to number 1, increased hormone sensitive lipase or HSL activity and decreased lipoprotein lipase or LPL activity. So you should know the basic. What is the basic? Insulin normally inhibits the HSL in or hormone sensitive lipase in adipose tissue, and insulin deficiency leads to the disinhibition of the HSL, that is the hormone sensitive lipase, and HSL ultimately causes the increased lipolysis, and that will lead to a massive release of free fatty acid or FFA into the circulation. And this free fatty acid in turn stimulates the VLDL production in liver. This is why the VLDL level is increased in that case. Now come to the decreased lipoprotein lipase or LPL activity. So insulin actually is required for the synthesis and activation of the lipoprotein lipase on capillary endothelium, and LPL is responsible for what? For clearing the triglyceride rich lipoprotein, that is VLDL and chylomicron. So think systematically. Decreased LPL activity means delayed clearance, means that will lead to the hypertriglyceridemia. So this combination, that is the combination of overproduction of the increased HSL and impaired clearance of lipoprotein lipase, causes the typical diabetic lipid profile abnormalities, that is the high triglyceride, high VLDL and low HDL. So here is the high fact. Actually, this typical mechanism explains why in severe hypertriglyceridemia, that is triglyceride level more than 1000 milligram per deciliter in diabetics can precipitate the acute pancreatitis, and in this case insulin therapy often rapidly corrects the hypertriglyceridemia by reversing the enzyme defect. So if you apply your basic, apply your concept, you can pick up the right answer very easily. This is not about the rote memorization. So keep emphasis on your concept, on the subjective concept. So we'll make another video related to the all about the diabetes mellitus and its related abnormalities and management in our different videos in future, and you can get your proper conception, that will be the concept based and content based videos, and listen them all of them carefully so that you can build your proper conception to crack the different tricky MCQ in your forthcoming PG entrance examination. Okay, so here is the bullet point. In adipose tissue, increased HSL leads to the lipolysis, causing flux of the free fatty acid, that leads to the increased VLDL and decreased LPL. Okay, so this is all about this particular session, this particular video. Actually, will come with our next video very soon. So be strategic and give your focus properly in your preparation. So this is all for the today's session. Thank you very much.